Greetings to all the viewers. My name is Mehakpreet Kaur, and today I'm here to present my capstone project on the topic mental health of nurses in Canada. To introduce the topic of my project, it is the deteriorating mental health of nurses in Canada, particularly talking about the Toronto region. So, the related research to my topic showed that there are not one but many causes that can lead to men, Canadian registered nurses and other nurses have mental health symptoms while at work, affecting patient care and self-safety. To name a few are COVID-19. It is a recent example, and the research shows a significant increase in anxiety and depression levels. Others could be psychologically traumatic events that can lead to PTSD, that is post-traumatic stress disorder, witnessing human suffering and life-threatening diseases and illnesses and injuries of patients, and physical assault. Uh, Many nurses have reported that they have experienced physical assault on uh, 11 or more times, according to a research listed. And poor and burnouts can be caused by poor working conditions, short staff shortages, and ineffective leadership. So the mental health problems that are affecting Canadian nurses is post-traumatic stress disorder, generalized anxiety disorder, major depressive disorder, and panic disorder. The other problems are like burnouts. As a future nurse leader in a Toronto Region Hospital, I will propose the following solutions and a work plan to positively impact and positively improve the mental health nurses of the hospital. So the proposed solution will be an anti-stigma program that will be inspired by Ontario's Central Local Health Integrity Network's anti-stigma program to remove stigma around mental health in nurses. Easy access to screening tools. Easy access to screening tools will help to identify early and self-identification of diseases like anxiety and depression by the nurses. Incident briefing can be done by the authorities or people like nurse manager after a psychologically traumatic event. Mental health training programs will be designed for the nurses. Late Career Nurse Initiative. This is by the Registered Nurse Association of Ontario. In this, the retired nurses will be uh, uh, hired to train the new nurses in order to build confidence and reduce burnouts. Mandatory regular assessment for psychological risk. This can be done by nurse managers, the unit managers of all the working staff members and healthcare teams in order to identify any mental health symptoms, and referral services will be available for nurses and healthcare team members in case they need it. The nursing theory that I'm using is Henderson nursing theory, since it focuses on the basic needs of a person that affect the development and growth. So this theory will help to focus on the basic needs of the nurses in a workplace. The leadership theory or the style I'll use is transformational leadership. That will be a lead by example, take initiative in removing stigma, and designing and developing training programs and encouraging nurses to look after their mental health, take measures, and advocate for the late career nurse initiative. So the implementation of the work plan will take up to 3 to 6 weeks to take these solutions and apply the nursing theory and leadership style by example. So the expected outcomes and the sustainability plan, the expected outcomes will be the facilitators or the nurse managers. They'll know what to say and not just ignore their nurses' requests. Nurses, after the anti-stigma program, will be more motivated to talk about the talk about their mental health through social contact. Early identification and screening will be done by easy access to screening tools. Constructed leadership, this will help to this will be performed by the authorities or the people in leadership roles to uh, improve the mental health of nurses. The one thing that I would like to add is one-on-one sessions that would be done by nurse managers with the staffs. The only barriers to this would be lack of time and motivation of the nurse managers. All on whole, I expect a positive outcome on the mental health nurses of mental health of the nurses in the Toronto Region Hospital. The sustainability plan can be the sustainability plan is that there will be continuous planning and monitoring that these measures are continued. Management will form norms and mandatory practices such as incident debriefing. Uh, there will be regular reporting sessions of people in leadership roles to the hospital authorities and a constant maintenance of good working conditions and quality of work life. All these measures will be aimed and will result in positive mental health nurses of Canada. These are the references used by me. Thank you for your time and patience.